To begin first with the millions of Americans ignoring warnings from the CDC not to travel tonight. A dangerous move that health experts are warning will send the deepening crisis into an even faster and deadlier tailspin. Tonight, one model used by the White House says Americans should expect the death toll to double by the 1st of March to nearly 500,000 people nationwide. With millions already on the road or in the air tonight, part of an estimated 50 million Americans expected to travel for Thanksgiving, experts say it is guaranteed that cases of coronavirus will soon explode, even more than they are right now. More than 3 million Americans have been infected since the beginning of the month. That means about 1 out of every 4 infections of COVID-19 since the pandemic began has happened in just the past 3 weeks. The country's seeing record numbers of hospitalizations and averaging 1,500 deaths every single day, the highest it has been in 6 months. About the only good news ahead, experts say, is that another vaccine created by the drug maker AstraZeneca and Oxford University appears to work, and it could be as much as 90% effective. We have a lot of new reporting for you and your family tonight, and our team of correspondents is standing by to cover it all. CBS's Kris Van Cleave is going to lead us off tonight from Reagan National Airport. Good evening, Kris.
Margaret, those record-setting cases are causing a spike in cancellations at airlines and Amtrak. But let's be clear, millions of people are traveling for this holiday, and that has doctors worried about the potential of a deadly COVID surge just in time for Christmas. Tonight, images like this crowded terminal in Phoenix have public health experts on alert. As COVID cases soar, millions are sticking to their Thanksgiving travel plans despite the CDC urging them to stay home. Karen Bryan was met by long lines in L.A.
There's a lot more people here than I thought would be here.
More than 3 million have been screened at TSA checkpoints since Friday. Sunday was the busiest day at airports since March 16th.
Both of us have been quarantining for the last 2 weeks, and we wanted to go see family.
AAA expects up to 50 million Americans to travel.
I'm very concerned about the number of people who are traveling. I mean, this is a recipe for disaster.
Lines at testing centers continue to get longer across the country, like here in Colorado.
I'm getting tested just so that I can spend Thanksgiving with my mom.
The biggest misconception I've heard this entire pandemic is that if I get tested today and I'm negative, I can see grandma tomorrow. Absolutely not. There's a 2 to 14 day incubation period. So if I get infected today, I may not become infectious, able to infect somebody else for 2 to 14 days.
This is COVID fatigue is reaching a dangerous level as people packed into this bar in Fort Lauderdale and crowded this church event in Tulsa. But in many states, the pandemic is growing even more dire. Pennsylvania could run out of ICU beds within a week. More than 3,000 Wisconsin healthcare workers signed a letter warning they're on the brink of deciding who gets treated and who doesn't. And just days from Thanksgiving, the economic fallout of coronavirus is spelled out in long lines of cars at food banks as so many struggle to put a meal on the table this holiday.
This is the worst hunger crisis in modern American times, and unless the federal government does something big and quick, we're going to see starvation conditions like this country hasn't seen since the Great Depression.
Dr. LaPook also recommends if you are traveling that you wear a mask whenever you're around people who you don't live with, particularly indoors, and to try to separate the act of Thanksgiving eating from Thanksgiving socializing, even if that means eating in separate spaces and then coming together to socialize, but with your masks on, and if you can, open the doors and windows for extra ventilation. Margaret?
Good advice, Kris. Thank you.